Maternal cardiac arrest, including during this pandemic, is thankfully rare, but when it does occur, the risks of COVID-19 requires additional consideration. Any patient in a healthcare setting may have COVID-19. UK and international resuscitation bodies deem chest compressions to be aerosol generating, so appropriate PPE is needed. Because PPE takes time to don, key team members should don full AGP PPE if caring for a woman at risk of deteriorating into cardiac arrest. The Resuscitation Council have produced a guide to help teams safely manage cardiac arrest during this pandemic. Firstly, recognising cardiac arrest. If a woman collapses, check for signs of life by placing a hand on the chest or, if trained to do so, checking for a pulse. If there are no signs of life, call for help. Unless you're in full PPE, do not start chest compressions, but prepare the woman for the team's arrival. The woman's nose and mouth should be covered, ideally either with an oxygen mask or a surgical face mask. Manual uterine displacement can also be performed whilst awaiting the team. In the team responding to the emergency buzzer, the first responder ascertains the nature of the emergency and relays it to the team, and then acts as gatekeeper. The 2222 cardiac arrest call should ideally notify both the maternal and neonatal resuscitation teams about the potential for COVID-19.
Central Delivery Suite, Room 12.
The resuscitation equipment should also have PPE available for the first responders. Many units will keep the main resuscitation equipment outside the room and pass items in as they're needed. Since defibrillation is not aerosol generating, attaching a defibrillator is a priority. If the rhythm is shockable, defibrillation should not be delayed and can be done whilst waiting for the team to don PPE. If an oxygen mask is attached, turn it off at the wall before shocking. This way, the woman's nose and mouth are still covered. Once full aerosol generating procedure PPE has arrived, the team don. As this is a maternal emergency, the anaesthetist is prioritised to don first, assisted by another team member for efficiency. Additional PPE for the whole team should also be obtained. Once the anaesthetist is confirmed ready, they can take their airway equipment and enter the room. However, they do not start resuscitation until those without full AGP PPE have retreated to a safe distance. As the rest of the team arrives, they take on their respective roles. Airway intervention should be performed by someone experienced. Two-person mask ventilation and intubation can be done by those with expertise. During resuscitation, the uterus should be manually displaced. Reversible causes of cardiac arrest need to be considered. In pregnancy, this includes delivery of the baby, ideally within 5 minutes of collapse. If the neonatal resuscitation team, in full AGP PPE, prepare their equipment outside of the room, they can then receive and resuscitate the baby in an area that minimises the team's potential exposure to COVID-19 from the mother. The maternal resuscitation continues, swapping team members as they tire, using grab bags to obtain equipment such as for cannulation. Use an algorithm to guide the treatment. If there is return of spontaneous circulation, post-resuscitation care should be planned. After the resuscitation, all equipment used should be disposed of or cleaned according to national and local guidelines. Airway equipment especially should not be left lying around. Yanker suckers can be placed in a glove and disposed of. PPE must be removed carefully in accordance with national and local guidelines in order to minimise the risk of contamination. Gloves first, followed by hand hygiene, and then gown and eye protection. FFP3 respirator is removed outside the room before washing hands with soap and water. Debrief is important after a rare event like this, even when there is a positive outcome as shown here. It helps the well-being of the team, allows personal and organisational learning, as well as to support the partner, the family, and at a later date, the woman.